Have you thought about getting a hair transplant, but you're not quite sure what it entails? I'm Dr. Vincent Ehlers, hair transplant surgeon at Aesthetic Options in South Africa. Stay tuned, I'm going to walk you through the process. So what is a hair transplant? Certain hair in the body is resistant to something known as DHT, which drives male pattern hair loss. This is mainly the back, the sides, the beard, chest, armpit, body, and pubic hair. And technically, all of this hair can be used to be relocated into areas where we experience loss. So the process starts off with a thorough consultation, where your doctor or surgeon will assess the back and size of the scalp, known as the donor area, as well as to ensure that you're a good candidate for the hair transplant procedure. The result that you can achieve depends on how much hair is available for this. During the consultation, it is important to discuss what your desired outcome is, and for your doctor to give you an honest opinion whether this is achievable based on the hair that is available. Following the thorough consultation, we move to the hairline design, the frontal hairline, as well as mapping out areas that require coverage so that graft allocation can be done correctly. Up next, we move to the shave, shortening the hairs so that it is easy to cannulate them during the harvesting. A hair transplant procedure is relatively painless. We do this under light sedation as well as a local anesthetic block, infiltrating the areas that we're going to be working in to ensure a comfortable process throughout. We then inject a solution known as tumescence into the area in order to swell the tissue, to create a bit of tension, and to help reduce the amount of bleeding. Then we move on to the harvesting, using a punch, typically 0.7 or 0.8 millimeters in diameter, to remove each individual hair follicle one at a time, ensuring no damage occurs to the surrounding follicles, and during the healing process to ensure that scarring is near invisible. Following the punching, the follicles are removed individually and then sorted by single, double, triple, or even quadruple strand hairs, and this is important for the allocation. For instance, frontal hairline should only be taking single hair follicles to ensure a natural and irregular pattern to the hairline. Once we have completed the extraction and analysis and sorting of all the grafts, we then move on to the site making. Small incisions are made with sapphire blades, ensuring that angulation as well as direction of the hair are matched. Next up, we reinsert the follicles. Some surgeons prefer implanted pens, which can be used especially when transplanting patients with long hair, or they can be placed with the use of forceps. Following replacement of all the grafts, where we move on to is dressing the donor area. We'll ensure it is clean and dressed appropriately, and that is hair transplant in a nutshell. Stay tuned, and we'll be doing a video on how to take care of your hair transplant procedure.